Fantastic. Well, great. I hope you're ready for some good news stories today, right? It's been a rough year. Go ahead and please be seated. Want to welcome and thank you for being here today to honor our graduates. I'm Craig Phelps, president of AT Still University, and it's an honor to have you here today. Also, thank you for wearing your mask and maintaining a safe distance from non-family members. Missouri has over 600 confirmed cases of breakthrough COVID infections, even for fully vaccinated individuals. So we ask that you wear your mask today to protect our graduates who will be going on to residencies and into practice. To children in the audience, we have some immunocompromised family members today, some undergoing chemotherapy and chronic disease. So the correct way to wear the mask is over the nose and mouth. If you need to take a break to go outside, the ceremony will last probably a little bit over an hour. So we understand for some of you that could be necessary to go outside and take a little break. If we see folks in the audience without a mask, we'll stop the ceremony until everybody can mask up so we can keep everybody safe. And I think it's a tribute to our students who every day had to get up, put on PPE many times, had to go through that on a daily basis for well over a year. And so we want to thank our students and faculty and staff for keeping everybody safe. ATU is fortunate that we only had 3 to 5 cases of COVID per week in Arizona or Missouri. No hospitalizations and no deaths. And that's once again 5,000 people safe because of your students, your sons and daughters and grandsons and granddaughters and nieces and nephews. So once again, thank you for being respectful for the students and taking care of those in the audience that have not been vaccinated yet. I see a lot of children out here, and we know that there's still a risk for them. And once again, this is a little tighter inside, right, than normal, and so we want to make sure we follow that. Well, it's going to be, like I said, a great day. I think we're going to, once again, have lots of good news and get to celebrate these wonderful graduates and their accomplishments. Dr. Norman Gevitz will now give the official welcome and greeting.
Good morning. Welcome to the AT Still University Missouri School of Dentistry and Oral Health Class of 2021 Commencement Ceremony. Behind the mask, I'm Dr. Norman Gevitz, Senior Vice President of Academic Affairs for ATSU. This is a very special day in the lives of those receiving degrees from AT Still University. All of you now have the tools and capacity to make a difference in your communities and in the lives of the people you serve. The degree each of you will receive today is not just a credential. It is a testament to your proficiency and competency in mastering a range of difficult subjects. Congratulations, we are proud of you. Your faculty and administration wish you the best, and we look forward to hearing from you as you go forward to improve the lives of the people in your communities. Thank you.
Thank you, Dr. Gavitz. Good morning. I am Dr. Dwight McLeod, Dean of the Missouri School of Dentistry and Oral Health. It is my honor to introduce the stage party. Please hold your applause until the end. Starting on my right, Dr. Craig Phelps, class of 1984, Kirksville College of Osteopathic Medicine and president of AT Still University. Today's commencement speaker, Mr. Gary Harbison, Executive Director of the Missouri Coalition of Oral Health. Dr. Norman Gavitz, Senior Vice President of Academic Affairs for AT Still University. On my left, Dr. Grishandra Branch-Mays, Vice Dean, Academic Affairs, Professor and Presenter of the graduates. Would any graduates or guests who are current or retired members of the uniformed services or first responders please stand and be recognized? Thank you for all you do for our communities and our country. Please be seated. I would like to recognize friends and family in the audience today who have supported the graduates on their journey. Thank you for your support that you have given to our graduates and for entrusting them to us. It has been our honor and privilege to have these young men and women learn with us. Please give them all a round of applause. I would also like to recognize MOSDOH's outstanding staff, faculty, and administrators who are joining us virtually due to COVID-19 restrictions. And finally, I would like to introduce the exceptional class of 2021. Graduates, please stand. Thank you. Please be seated. Now, I would like to share with you some important statistics for the class of 2021. There are 42 Doctor of Dental Medicine graduates, composed of 19 ladies and 23 gentlemen. 18 states are represented. 5 graduates are from the state of Minnesota, 3 graduates each from Tennessee, Wisconsin, and Texas. 19 graduates are from other Midwestern states and other regions of the United States, not including Missouri. 12 graduates are from the state of Missouri, and 14 graduates will reside and work in Missouri. Class of 2021. Today, your modified traditional commencement marks a new chapter in the history of ATSU University, Missouri School of Dentistry and Oral Health. You are the 5th cohort of classes to graduate and the first to have a socially distant commencement ceremony. You deserve all the fanfare that this graduation brings. Almost 4 years ago, you became a member of one of the world's greatest health professional institutions, ATSU University. The fact that you stand proud today is not by chance, but because you knew you were joining the founding school of osteopathic medicine with its strong, steadfast values dating back to 1892, and its bold mission, vision, and goals. Your time here has been filled with enriching educational, institutional, and professional experiences. Daily, I'm enthused and energized by the Missouri School of Dentistry and Oral Health staff, faculty, and administrators' commitment to ensure the progress, well-being, and success of all our students. There is certainly a feeling of family here. I am delighted to be a member of the caring and person-centered institution that I am sure you are too. Please know that the challenges we're all facing will better prepare us to manage the difficult decisions we'll have to make in our personal and professional lives. During these last 14 months, we have grown in our leadership positions and we continue to learn as we go. We are all hoping for a brighter tomorrow. As we look ahead, we know that hope for all of us may not look or appear the same, but the feeling when hope is realized is certainly an undeniable experience that is similar for all people. I stand here hopeful that the education you have received and the degree that you have worked tirelessly to earn will continue to empower you to use it in accordance with the professional oath in dentistry you took on July 8th, 2017 on the football field of Kirksville High School. As new healthcare providers and leaders, you will have the professional power to influence and positively change the population you serve through adhering to your professional oath of equal and just treatment for all patients. You have a moral and social responsibility to treat all patients equally and advocate for their well-being. You can make a significant impact in helping to reduce the inequities and unjust treatment in healthcare and the undesirable social determinants of health that have for decades devastated generations of underserved populations in our nation. Please don't underestimate the impact of your professional influence and the opportunity to institute change. Dr. Andrew Taylor Still, though daunted by the difficult changes of his time, never wavered in his pursuit to achieve his goal of founding a branch of medicine that at its core supports success, access to care for all people. For 129 years, ATSU University has been educating and graduating healthcare providers to provide care for disadvantaged populations in underserved communities in the spirit of its founding osteopathic beliefs and principles, which we now proudly embrace as our osteopathic heritage. Our hope is that as our proud alumni, you will continue the tradition of Dr. Still and fulfill the mission of the Missouri School of Dentistry and Oral Health while advocating for change in the community you serve. Dentistry is deeply rooted in science and research. The science behind research is powerful. I stand here today grateful for the many breakthroughs that have been made from research and science that have advanced the human race, cured diseases, improved living conditions, reduced public health risks, prevented epidemics and pandemics, and have vastly improved humans' well-being and life expectancy by decades. The same application of research and science in dentistry has improved the quality of oral health through new techniques, therapies, and innovations, thus prolonging tooth mortality and bettering overall systemic health, quality of life, and of course, smiles and appearance. The COVID-19 vaccine, a remarkable achievement through science, has made it possible for us to practice dentistry more safely, assure access to dental care, and to celebrate with family and close friends. For us, this is a game changer. I remain truly thankful and yet saddened as I reflect on the many individuals who didn't have this opportunity and the billions of people globally who are hoping and waiting for the day they can be vaccinated. Today we reflect on the past 4 years of your training, your achievements, and the friendships that have been built, some of which will be lifelong. Your kind words, your deeds, and your strong support will never be forgotten. You will always be remembered by administrators, faculty, and staff. You have proved that as future healthcare providers, you have the patience and the ability to adjust to even the most daunting and deleterious circumstances. Class of 2021, today is a new beginning for you. You have achieved what only a fraction of the globally educated population has accomplished. You have worked tirelessly under mental and physical stress, economic challenges, and strained relationships, but with assurance and strong support from your family and loved ones, faculty, staff, and administrators, you will earn one of the most coveted degrees, the Doctor of Dental Medicine degree. Over the past 4 years, you actively participated in community service projects, logging over 9,000 hours in service for dentistry in the community, and averaged 38 events each year for a total of 152 events. 33 events in academic year 2017 to 2018, 25 events in academic year 2018 to 2019, 50 events in academic year 2019 to 2020, and 34 events in academic year 2020 through 2021. Your outreach efforts impacted the lives of thousands of underserved individuals in rural and urban communities. You participated in outreach events including fluoride varnish programs or preventive service programs, interprofessional education outreach activities with Kirksville College of Osteopathic Medicine, St. Louis College of Health Science and Pharmacy, and St. Louis University Health Resource Center. Health fairs, the Better Oral Health for Veterans Project, in-state dental mission trips to Dexter, Missouri, and provided education and direct care to older adults. You increased access to oral health care, providing over 3,800 procedures in 33 community health centers, of which 19 are in the state of Missouri. You completed all your essential experiences and competencies for a 95% on-time graduation rate. You took the Western Regional Examining Board and as a class achieved a 97.5% pass rate, and you're now eligible to practice dentistry in 40 states. You accomplished all these achievements despite operating amidst a pandemic. As of today, we know that 5 of you will work in community health centers. 1 graduate will work with the Indian Health Service in a community health center. 7 will work in corporate dentistry. 6 graduates will work in small group practices. 15 graduates will be working in independent private practice. 3 of our graduates are undecided, and another 5 will go on to seek advanced education in residency programs. The 12 graduates that are from Missouri, plus an additional 2, for a total of 14 graduates, will live and work in Missouri, thus increasing access to oral health care in their respective communities. Today is indeed a jubilant day. The administrators, faculty, and staff of the Missouri School of Dentistry and Oral Health celebrate your successes and acknowledge your contributions. Now, I would like to read a commencement address to the class of 2021 from your class president, Mr. Drew Williamson. Mr. Williamson states, "I am very honored to speak on behalf of my classmates this morning. This day marks the end of a 4-year-long journey that each of us have worked hard to achieve. While this day may be about us, it would be wrong to not say thank you to those that have gotten us to this point. Starting from the beginning, the class of 2021 would like to say thank you to the Kirksville faculty that challenged us and took us through our preclinical preparations, which gave us the foundation to become the students we are. We also would like to say thank you to the St. Louis clinical faculty. Without your guidance and willingness to share your experiences, we would not be able to be the clinicians we are and will become. To the staff and administration, this school would not be a school without you all. So thank you for giving us the opportunity to be dentists. Sometimes they say, save the best for last. So to all our family, friends, and loved ones that fill the seats behind and near to us, the class of 2020-21 would like to say thank you. We would not be able to sit in the chairs beside you and put on this cap and gown if it was not for you. We would not be the people that we are today without you. So, class, please join in a round of applause to all those that made us the clinicians, dentists, and people we are today. Class. This last year has been anything but ordinary, and looking around, this was never the vision that we had in mind when we started. We all have been a part of the most uncertain years ever in a dental school setting, and the ability to adapt and change is the reason we can sit in these seats today. This year has instilled a characteristic in all of us that will make changes in the next phases of our lives seem minuscule. We are all part of a group that has shared almost every day together for the last 4 years and shared experiences that few people get to do in this world, which is something we should never take for granted. I would like to end by saying congratulations to you all, the class of 2021. Mr. Drew Williamson, thank you for those words of gratitude and encouragement. It is my pleasure to introduce today's commencement speaker, Mr. Gary Harbison. Mr. Gary Harbison has served as the Executive Director of the Missouri Coalition for Oral Health since late December 2011, the year the agency reorganized. Since then, he has provided leadership through several significant changes in Missouri oral health, including reinstatement of adult dental benefits in Medicaid, establishment of the Oral Health Caucus in the Missouri Legislature, and filling the Missouri State Dental Director position after nearly 12 years without oral health leadership in the state system. Mr. Harbison has developed Missouri Coalition for Oral Health into a focused and strategic statewide network of advocates dedicated to health equity and access to care. He was awarded Oral Health Champion by the Missouri Dental Hygienists Association in 2018. Missouri Coalition for Oral Health was awarded Health Advocacy Organization of the Year in 2016. Prior to his work with Missouri Coalition for Oral Health, Mr. Harbison worked in a variety of leadership positions, including Kansas Mental Health Director, Mental and Child Health Title V Director of Special Health Care Needs at the Missouri Department of Health and Senior Services, and Director of Outcomes Evaluation at the Missouri Department of Mental Health. Mr. Harbison worked in community mental health, psychiatric rehabilitation, and hospital-based psychiatric services. As an individual, marital, and family psychotherapist, he has worked in community service and in service to people with complex health challenges for most of his career. Mr. Harbison serves on the board of the American Network of Oral Health Coalitions and is a fellow of the American College of Mental Health Administration. He has a Master of Arts degree in Psychological Counseling and a Bachelor of Science degree in Psychology, both from Southeast Missouri State University. Please welcome Mr. Gary Harbison.
Thank you for that very kind introduction. So today is about you and your magnificent achievement, not about speeches, but I hope you will humor me a bit. In the course of a few minutes, I'm going to do my best to project you into the future. But let me start by telling a quick story. I have 4 young adult children who are fairly close in age. When they were little, our household was a dynamic place with many activities and a lot of energy. One typically hectic evening, for some unknown reason, I answered a random phone call. It was a nice salesperson trying to convince me to subscribe to the Post-Dispatch. I told her several times that I was not interested, but she continued. Finally, in frustration, I said, I have no time to read the paper. I have like a bazillion kids. There was a pause. Then she said, "When did you get the Brazilian child?" Obviously, that conversation had taken a wrong turn. I ended it quickly. Communication is difficult. I hope to communicate a bit better today than I did in that conversation. Now, at this point, you may be thinking you have a commencement speaker who will tell you stories out of context, but hang in there and I will try to make the connection for you. But let's get back to congratulations. Truly, what an achievement. Each of you has become something unique and important and greatly needed. To say that you are graduating at an unusual time is a dramatic understatement. What a strange time we're living through. It has been horrible and frightening and tragic. The pandemic has required unprecedented flexibility by institutions and individuals. So please allow me to state the obvious. You have completed dental school during a worldwide pandemic, a pandemic that has impacted every aspect of our individual and communal lives. And dental school is never easy. So I feel compelled to use that overused word. Amazing. You are truly amazing. This time and your achievement will have ripple effects for years to come. Going forward, you have very little reason to doubt yourself. The pandemic has been a great teacher to us all. We have learned about resilience and bravery of individuals, communities, and leadership. We have learned that truth and trust is fundamental to meeting the challenges we face. We learned that science can move fast, that technology can be an integral part of our everyday lives and our work. And we have learned that we are leaving the most vulnerable behind. There are many other lessons about family, psychology, culture, and faith. The pandemic will continue to be a teacher to us all for years to come. In a general sense, this horrible pandemic forced us to widen our view. Most of us began to think more about our collective well-being than just our individual lives. Americans have a great tendency to think in only individualistic terms. I think that perspective has its strengths, but it can allow us to miss things. As that great American philosopher, Bruce Springsteen, said, "Nobody wins unless everybody wins." Could there be a better real-world illustration than a pandemic? As you go out to provide excellent professional service, and I have no doubt that you will do just that because you are committed to excellence, I want to encourage you to build on the outstanding foundation ATSU, Missouri School of Dentistry and Oral Health, has provided, and I want to encourage you to keep the wider view. It will serve you well and will open up possibilities that you are perhaps not able to imagine right now. The greatest state dental director may be among you, or one of you may be the leader that guides a successful advocacy effort to fully fund public dental health so that no one ever again goes without needed dental care. This room is full of possibility and the potential to reach unimagined achievement. The pandemic opened up some issues we previously did not talk about much as a society. The terms health disparity, health equity, and structural racism are repeatedly referenced in national news. Previously, I could not have imagined those terms would get such broad public attention. These are difficult, multivariate issues without a simple solution. But as a nation, we are talking about these issues in new ways. And this means that there is possibility that could have only been imagined in the past. Your personal potential and possibility at this moment coincides with new national possibility. Just as the pandemic has forced adaptation of healthcare systems to meet unique needs, the future will hold many positive changes for healthcare delivery, including transformative change for dental health. I cannot see into the future clearly enough to predict all of the change that will come, but I am sure that technology will continue to have a great impact on healthcare. More than any previous, it is your generation that will drive the use of technology in healthcare. Teledentistry and all of its varied application will be an increasing part of the way dental care is accessed. Teledentistry is a way to increase access while pushing the entire dental system more in the direction of prevention and taking care more closely to where people live. It is also a mechanism to preserve the limited resources we have to provide dental treatment and to increase the efficient use of those services. This is critical to solving health inequity. Dental health equity is still not mentioned in the media much, but it is a key part of health equity. I do not understand how we can think dental health is extra and to be left for later, but Americans do that all the time. And so do American policymakers. We have every reason to believe Missouri will continue to have oral health access issues in the vast majority of our counties and for many urban residents. Your skills and abilities are badly needed and will continue to be badly needed. I do not know how much exposure you have had to teledentistry at this point, but I encourage you to take time to learn about it and how you can use it. I will add that I believe it is not just the right thing to do for public oral health. It will provide opportunity for personal growth as well as practice growth and development. A few years from now, I believe teledentistry will be a standard part of oral health care. The coalition has worked long and hard to develop teledentistry, starting conversation as early as 2013. It is instructive that the Missouri Coalition for Oral Health is not just a nice sounding title. We are truly a coalition. That means that many organizations and individuals have helped move Missouri from a state with no teledentistry to one of the first states to have laws that allow it and practitioners who are using it. Our thanks to everyone who continues to work on this and other important innovations. There are many changes coming regardless of your direct involvement. Some of these changes will involve technology, some will involve how services are paid. Expect to see value-based funding mechanisms and other new payment structures continue to come our way. Increased use of case management, greater reliance on healthcare data, and greater integration of oral health care and overall health care, including health information exchanges. The fact is, there are a lot of people who are keenly interested in healthcare and in dentistry and in the intersection of healthcare and technology. It is my hope that the primary driver of this interest is the health of the public. The wider view tells us we must drive the system toward greater access, achieving community oral health and maintaining it. It is our responsibility to ensure that change is driven to have positive impact. But let me be clear, I do not believe that obtaining community oral health in the United States rests solely on the shoulders of this accomplished graduating class or solely with oral health professionals. You are a key part, an essential part, but I urge you to not operate under the seductive illusion that what happens in the dental office will change the conditions that create the deep oral health disparities in this country. People carry with them history, culture, and shared experience, which influences individual choices. Simply educating people about what is right to do can only work between people who have shared history and culture, and when communicating in that way as part of the cultural norm. The harsh reality is, as a country, we have left a large swath of the public out. Missouri and much of the country is in an unacknowledged oral health crisis. The available numbers tell us that, and so have several surgeons general. I am sure your experience here has illuminated community need. For much of the U.S. and for most policymakers, there is no oral health crisis. It is easy to look at the way things are and assume that these conditions are intractable, part of the way the world works and somehow unmovable, or at least nearly impossible to change. In fact, the way things are is the result of many decisions by many policymakers over many years. We are fortunate to live in a country that has mechanisms for change. As frustrated as we are with the process, it actually works, or it can work if we make it work. Sorry, little cough. Something magical happens when people and groups accept that there are differences of opinion, some of which cannot be resolved now, and work together on areas of agreement. There is nothing more powerful than groups of diverse constituents holding up the same request and the same message. For most decision makers, unity is very attractive. In Missouri, adult dental benefits were cut from Medicaid in 2005. Many thought it impossible to get them back through advocacy. The coalition led the successful reinstatement in 2016. It is true that policy and systems change is a very different endeavor from dental practice. Policy change is imprecise, full of mistakes and false starts. I can tell you a lot about advocacy, but the truth is the context changes all the time, and that necessitates change in advocacy. There may be a cookbook for advocacy, but if there is, it is one in which the recipes change themselves. Most importantly, policy change involves communication as a key tool. Communication in the context of policy is far trickier than most people know. It is easy to be misunderstood. Just think of that Brazilian child I supposedly had causing trouble at my house. Make no mistake, as a young dental professional, you have an individual voice that will be listened to. Policymakers are typically eager to hear from young professionals. They are eager because you are key constituents. But it is in collaboration with others that we can move the health system in a truly positive direction. Collaboration is an often overused word, tossed in the mix during strategic planning, included in white papers, mission statements, and vision statements. Making collaboration a living, breathing reality is something else altogether. It takes trust and it takes agreement on goals. Once spelled out and agreed upon, though, we can collectively achieve goals that cannot be achieved without real collaboration. Taking a broad view is messy, less than precise, and absolutely necessary if we are to ever address health inequity in a real and lasting sense. We are gratefully and finally coming to what appears to be the end of this pandemic. Will the world ever be the same? I don't think so. Maybe in 100 years or so, we will have forgotten about this pandemic, as we almost did with the 1918 pandemic. I think, though, that some things will remain with us for years and years to come, and some of the opportunities this horrible pandemic has created will have been used to guide change. As you go out to provide spectacular care, all you need to do to expand on the positive impact you will have is to keep a wide view and stay open to opportunities to impact community health. I cannot wait to see what you do. Thank you.
Thank you, Mr. Harbison, for those inspiring and encouraging words. Your speech gives us hope. Please give Mr. Harbison another outstanding round of applause. Thank you. Public health is the field devoted to preventing disease, prolonging life, and promoting health through organized community efforts and informed choices of society, organizations, communities, and individuals. The Master of Public Health degree is a professional master's degree awarded for studies in areas related to public health, focusing on improving health through identification, prevention, and solutions to community health needs. All Missouri School of Dentistry and Oral Health graduates earn a certificate in public health with an emphasis on dentistry. Some of our students decide to complete the entire master's degree program while earning their dental degree. President Phelps, the candidates for the Master of Public Health have successfully completed the requirements for their degrees. Upon the recommendation of the faculty and program directors, I have the pleasure of presenting them to you at this time. Will the candidates for the Master of Public Health, please rise and proceed to the stage as your name is called.
James Freihofer, Claire Fries, Kristen Howard, Larissa Macedo, Caitlin Roseman,
It'll take just a minute or so as the graduates get their picture taken, and then we'll confer their degree. But I want to thank everybody again for being patient with us. When we decided to have graduations, in many of the universities were not including family. And thanks to Dr. McLeod and Dr. Branch Mays, we were able to find a venue and feel comfortable inviting family to the graduation and commencement ceremony. So once again, thank you for your cooperation. And one of the advantages to a smaller venue is there's less walking. One of the disadvantages, you get to see everything going on. So our graduates are getting their photos taken, and then they'll find their seat, and we'll have them stand up again so we can confer their degree. All right, if we can have our public health graduates please stand. Upon the recommendation of the faculty, dean, and senior vice president of academic affairs, and by the authority vested in me by the Board of Trustees, I hereby confer upon you the degree Master of Public Health, with all of the rights, honors, privileges, and responsibilities pertaining thereto. Congratulations.
Dental medicine involves the art and science of prevention, diagnosis, and treatment of conditions, diseases, and disorders of the oral cavity, maxillofacial, and associated regions. Graduates of the Missouri School of Dentistry and Oral Health are educated to become socially responsible, technologically adept dentists who will serve communities in need while engaging in lifelong learning. President Phelps, the candidates for the Doctor of Dental Medicine have successfully completed the requirements for their degree. Upon recommendation of the faculty, I have the pleasure of presenting them to you at this time. Will the first row of graduates please rise and proceed to the stage as your name is called?
Jacqueline Akmakjian, Paul Assad, John Aschenbrenner, Sarah Chinnery, Jarrett Crutcher, Kirkland Fairman, James Freihofer, Claire Fries, Audrey Friends, Lauren Fries, Christopher Gagnon, Allison Gerling. Nicole Gito. Ian Haggard. Reed Higginbotham. Kristen Howard. Brady Hull. Matthew Kyer. Bradley Kirkpatrick. Tanner Coonert. Taylor Little. Larissa Macedo. Melissa Madison. Lauren Maubin. Brandon Marth. Bhavik Mahanalo. Shara Myers. Stephen Neely. Danissa Nunez. Andrew Otto. Kapil Patel. Caitlin Roseman. Slaman Saeed. Ishu Priya Singh. Adam Stotts. Dallin Strong. Chad Strupp. Lindsay Stufflebean. Shayna Vercruzzi. Fu Vong. Drew Williamson. Eric Wood.
Thanks again for your patience. Sometimes people ask about this medal that I wear. It's not to protect me or give me any superpowers, and in fact, for ATSU, it's probably the only institution I'd wear bling like this. But it reminded me, as we're waiting for our graduates, of a couple humbling things that my son reminds me of. He's 13 years old, so you can imagine the daily votes of no confidence and uprisings that occur. But I'll never forget, I think it was in kindergarten or first grade, we were driving to school one morning, and he looked across the car and said, "Dad," he goes, "you're not the real president." I said, I know, son, I'm not the real president, just of university." He goes, "Yeah." He goes, what's the name of the president?" I said, "Oh, President Barack Obama." He goes, "Yeah, you're no Barack Obama." And then, last Saturday, he was in the musical Cinderella for the youth theater, and he was the king. Appropriate role for him. And I noticed that he was actually wearing a bigger medal than I had. So not only is the medal no longer a status symbol in the Phelps household, my son Zach now has a medal as the king from Cinderella, larger than the president's medal. But that's the nice thing about graduations. There are a lot of traditions, a lot of things that we remember today, and I know that our graduates are thankful that all of you could be here. And once again, as part of that memory is taking a moment so we can get a photo of them in their regalia, something that I think they'll cherish. And in a moment, you're going to hear the oath to the profession. And I would make a challenge to our graduates to take that oath, maybe put it in the waiting room or put it in their office. And you'll hear this oath. It's a beautiful oath for the profession of dentistry. And I can imagine that if a patient came in and saw that oath, they would say, wow, I am so glad that my healthcare provider, my dentist, adheres by that oath. And wow, I really want to come here for my dental and oral health care. So that'll be something that you'll get to share with. Dr. McLeod will read the oath. You can follow along in your program, and our graduates will follow along with reciting that. And that's kind of a little preview of some of the things coming up. Very good. All right. All right, if the graduates will please stand. Kind of the moment we've all been waiting for. Upon the recommendation of the faculty dean and senior vice president of academic affairs, and by the authority vested in me by the Board of Trustees, I hereby confer upon you the degree Doctor of Dental Medicine with all the rights, honors, privileges, and responsibilities pertaining thereto. Congratulations, doctors.
Thank you. Graduates, you'll find the oath to the profession in the commencement program on page 11. Graduates and all dentists, please stand. Of course, our graduates are standing, but if we have any other dentists in the audience, please stand. Please recite the oath with me loud enough so your family in the back or alongside you can hear. I pledge to faithfully fulfill my obligations as a member of the dental profession. My responsibility is to promote the health of the community and the person I serve. The health of my patients will be my first commitment. My practice depends upon the trust of my patients. I will not violate that trust. I will do no harm. I will honor my peers. I will respect the diversity they bring to the profession and commitment to our mutual success. I will honor my patients' dignity. I will be their zealous advocate, sensitive to their feelings, needs, and thoughts. I will not discriminate against any person in my decisions and care. I recognize the limits of my competence. I will seek knowledge and inspiration from my colleagues whenever my patients' needs require. I will strive to improve my knowledge and skills. I am responsible for contributing to the improvement of the community. I will strive to prevent disease and to correct adverse social conditions. I will serve as both a teacher and role model for my patients, my successors, and the public. I am responsible for upholding my profession's integrity. I will strive to counsel those deficient in character or competence and expose those who engage in fraud or deception. I will use my professional knowledge according to the laws of humanity. With this oath, I willingly assume these responsibilities. You may be seated. Thank you. At this time, I welcome President Phelps to the podium for his closing remarks.
Graduates, congratulations again. Thank you, Dr. McLeod, Dr. Gevitz, Dr. Branch Mays, Mr. Harbinson. Thank you for all that you've done today to make this successful and your great words and for your commencement address, reminding us that together we can do some amazing things. And certainly this group is amazing and will do wonderful things. I would also like to thank the MOSDOH family and staff for the work they do and have done to prepare our students and have a nice ceremony today once again where we can include our families. Thank you again to Dr. Branch Mays and the team coordinating the commencement and last evening's award ceremony. And thank you to the ATSU team, some folks that came down from Kirksville, from IT, academia, technologies, communication, and marketing, and all the staff who made today's commencement possible. Not easy during a pandemic. And now I'd like to induct our graduates into the ATSU Alumni Association, and this is something that is pretty unique. No matter where you go, you're going to be close to some ATSU graduates, whether it's from our public health and graduate health science programs or medical programs or other health professionals. We have more ATSU graduates working at community health centers than any other health sciences university in the country. So you won't be far from support, and you won't be far from those folks who will help you build your practice and want to see you be successful. So I encourage you, when you're out there and you have a moment after you've settled down, take a look and find out where there are some alumni nearby. When I was in medical practice, I had a lot of great dentists who referred undiagnosed diabetes, undiagnosed medicine reactions or medication reactions to the practice, and then vice versa. As a physician, it was comforting to know that I had a caring and loving dentist to refer patients to. So once again, you'll have that advantage out there as the alumni. But as we've said earlier, today is really about you, and it's one of the most important days in your personal and professional life. From this day forward, you will wear the mantle of a healer. It is important to remember that your education allows you to provide high-quality care, taking care of individuals, families, and communities. No one is better prepared than you, and no one can do it better than you. As Dr. Andrew Taylor Still summarized in his works, finding disease is pretty easy, but finding health is our true mission. As you move forward to the next phase of your career, we wish you Godspeed. Until we meet again, thank you. We ask that family and friends please remain in your seats until all the graduates have recessed outside where you can meet them and have some pictures and enjoy the rest of your day. Once again, thank you for taking care of those around you, those that are immunocompromised with chronic disease, our children, and those that are undergoing chemotherapy. So thank you for working today with us. We appreciate it. Let's have all the graduates stand up for kind of a big applause again. Yay!